Have you ever woken up feeling groggy, bloated, or like your body just didn't recharge overnight of sleep? Doctors are now raising the alarm. One common but overlooked habit, breathing through your mouth while you sleep, might be silently damaging your brain, heart, and metabolism. Most people don't even realize they do it. Yet the consequences are more serious than you might think. Mouth breathing at night may seem harmless, even normal, but studies show it can lead to low oxygen levels in your blood, dry mouth, poor sleep quality, and elevated stress hormones. Over time, this affects your brain's ability to function, your heart's efficiency, and even your body's natural ability to manage weight and energy. Many Americans assume snoring or sleep discomfort is just an annoyance, but doctors have found a direct link between mouth breathing and chronic health issues. Low oxygen during sleep increases inflammation, triggers blood pressure spikes, and reduces the brain's ability to detoxify overnight. The result? Brain fog, memory problems, fatigue, and an increased risk of heart disease. It all starts subtly. You may notice a dry mouth in the morning, occasional snoring, or restless sleep, but the body is already adapting to a pattern of reduced oxygen and chronic stress. This pattern silently affects metabolism, causing insulin resistance, weight gain, and even difficulty in maintaining muscle mass. Even more alarming, mouth breathing can impact the nervous system. When the body senses that oxygen intake is inefficient, it triggers stress responses, elevating cortisol, the stress hormone. Elevated cortisol at night interrupts fat metabolism, worsens sleep, and increases inflammation throughout the body. In children, it can even affect facial structure and dental health. But in adults, the damage is more internal. Cognitive function, heart health, and metabolic regulation take the biggest hit. Doctors now warn that this is one of the hidden causes of fatigue, brain fog, and stubborn weight gain that many people over 30 or 40 struggle with, despite eating well and exercising. So, why is mouth breathing at night so damaging? The answer lies in oxygen, or rather, how your body uses it. When you breathe through your nose, air passes through tiny nasal passages that filter, warm, and humidify it, allowing optimal oxygen absorption. Nasal breathing also produces nitric oxide, a molecule that relaxes blood vessels, improves circulation, and boosts oxygen delivery to every cell. Mouth breathing skips all of this. Oxygen intake becomes less efficient, blood oxygen levels drop slightly, and your heart has to work harder to circulate oxygen to tissues. Over time, this extra strain can contribute to higher blood pressure, increased heart rate, and even early signs of cardiovascular stress. Doctors are particularly concerned because many people are unaware this is happening. They think sleep issues are just normal or a minor nuisance. Brain function suffers too. During deep sleep, the brain clears out toxins in a process called glymphatic drainage. Low oxygen levels from mouth breathing reduce the efficiency of this process. This leads to poor memory consolidation, mental fatigue, and the persistent brain fog many adults complain about. Over months and years, this subtle oxygen deprivation can impact cognitive performance and even mood regulation. And then there's metabolism. Low oxygen and elevated nighttime stress. Hormones, especially cortisol, interfere with how your body processes glucose and fat. Insulin sensitivity drops, fat storage increases, and energy production becomes inefficient. This is why doctors see many adults who eat well and exercise but still struggle with stubborn belly fat or low energy levels. Mouth breathing also disrupts your sleep architecture. You may wake up multiple times without remembering it, reducing the restorative quality of REM and deep sleep. Chronic poor sleep, combined with higher stress hormone levels, creates a vicious cycle. Fatigue leads to poor food choices, cravings for sugar, and reduced motivation to exercise, all of which further harm metabolism and heart health. Even subtle nighttime habits, like sleeping with your mouth slightly open, snoring, or using certain pillows, can encourage mouth breathing. Doctors warn that small adjustments can have big impacts. Correcting this habit isn't about expensive devices or medications. S about training your body to breathe properly, protect oxygen delivery, and restore natural sleep patterns. Doctors recommend several simple but powerful strategies to correct mouth breathing at night and restore optimal oxygen flow, sleep quality, and overall health. The first and most effective step is nasal breathing training. By consciously practicing breathing through your nose during the day, your body begins to naturally adopt this pattern at night. Techniques like slow, deep breaths through the nose, combined with gentle pursed-lip exhalations, can retrain your respiratory muscles over a few weeks. Next, consider sleep position and environment. Sleeping on your back can encourage the mouth to fall open, so doctors often suggest sleeping on your side with your head slightly elevated. Using pillows that support proper neck alignment can also prevent jaw collapse that contributes to mouth breathing. Hydration is another key factor. A dry mouth makes mouth breathing more likely. Drinking enough water throughout the day and using a humidifier at night keeps nasal passages moist and makes nasal breathing easier. Some doctors also recommend saline nasal sprays before bed to clear blockages and maintain airflow. In certain cases, small devices like nasal dilators or chin straps can help keep the mouth closed gently while sleeping, encouraging nasal breathing without discomfort. However, these should be used under guidance to ensure they are safe and effective for your specific needs. Lifestyle habits also amplify results. Reducing alcohol before bed, addressing allergies, and managing congestion naturally improve nasal airflow. Simple exercises to strengthen jaw and facial muscles can prevent collapse and promote nasal breathing. Over time, these combined changes help restore natural oxygen levels, reduce nighttime stress, and lower inflammation in the body. Patients who adopt these strategies often report dramatic improvements within weeks. Deeper, more restorative sleep, reduced morning fatigue, improved cognitive clarity, better mood, and even gradual weight management. Doctors emphasize that these changes don't just improve comfort, they protect the brain, heart, and metabolism from long-term damage caused by chronic nighttime oxygen deprivation. The key takeaway is that mouth breathing may feel harmless, but it silently impacts multiple critical systems in your body. By adopting simple, consistent habits to breathe properly at night, you can reclaim energy, protect your heart, support your metabolism, and sharpen your brain function, all naturally. Mouth breathing at night may seem harmless, but as doctors are warning, it quietly affects your brain, heart, and metabolism. From chronic fatigue and brain fog to weight gain and increased inflammation. The consequences can accumulate over years, often without you realizing it. The good news is that this is one of the easiest health habits to correct. Simple steps like practicing nasal breathing during the day, adjusting your sleep position, staying hydrated, and using gentle nasal support can dramatically improve oxygen delivery, restore deep restorative sleep, and reduce the stress your body experiences at night. Within weeks, you may notice more energy, better focus, improved mood, and even subtle improvements in weight and metabolism. Small, consistent changes in how you breathe can transform your health in ways most people never expect. Remember, your body isn't broken, it's responding to the signals you give it. By taking control of this one overlooked habit, you can protect your brain, heart, and metabolism, and wake up every day feeling refreshed, energized, and ready to thrive.